Happy Super Bowl Sunday, everybody. It's February 9th. I'm dating this because I can't wait. The Chiefs and the Eagles. Let's see what happens. I know there's a lot of people rooting for the Chiefs and there's a lot of people rooting for the Eagles because they want to see somebody else win. But anyway, that's later. This is Nancy Pierre, CEO of We Care Home Care and Training Services. Welcome to We Care Home Care 101. Today, I want to talk specifically about how do we pay for home care services. And this is really important because I think a lot of times I spend time, being a nurse, talking about, the actual hands-on care. But before we get to that, there's the business aspect of it, paying for it, and making sure that it's something that you're going to be able to sustain, right? So I was speaking to a family recently. I'm going to say the daughter in particular. Her mother is in her 80s, and her stepfather, I believe, is in his 90s, and the mother's being discharged from the hospital. I believe the father was in the hospital too. The stepfather was in the hospital too. But the mother is who's being discharged presently. And we were going through the initial intake. We were going through, the preliminary conversation about home care services. And I think, I don't want to say we got stuck. I don't want to say that, right? But this, how do we pay for it? Do we need to change her insurance? Does she have long-term care insurance? Does she have some type of insurance that will provide and pay for home care services? And so, we got into that aspect of the intake, that part of the conversation. And, looking at, who is part of her care team? And when I say that, not necessarily who's going to hands-on take care of her, but who is part of her care team that's going to facilitate that she gets this service. And so does that mean that they're going to pay out of pocket? And I'll just share, and I share this all the time. When my mother, we had to initiate home care services for her, we had to find out, well, how much does it cost? Well, and it varies, like the hourly rates vary. I'm going to say anywhere from $30 to $45 an hour. And again, that depends on the caregiver and it depends on the state of the individual who's being cared for. So, we then, I had to start searching, for some candidates for an agency and how we were going to do this and how many hours a day that we needed, because she's bedbound. She can't get up. She can't do for herself. And how are we going to structure something that, provides, the service that she needs, but then keeps her mentally and emotionally well. A lot of times we think of just the physical, what's needed physically, so that someone maybe with, say, a dementia diagnosis, that, okay, they need someone during the day so that they don't, fall or, leave the stove on because they have memory issues, right? So they'll forget that there's a table there. And that there's a lot of like hip fractures and things of that nature that happens, due to, and there's wandering that happens. And I think for, someone with a Alzheimer's diagnosis, that is where, that round the clock care is not necessarily that the person's bedbound and they can't physically do certain things for themselves. It's more so to keep them safe, within the home, within their home environment. So, we got into this conversation. I was doing the intake and explaining managed long-term support services, and in which is the Department of Medicaid in the state of New Jersey that governs and pays for these services. They provide authorization through the MCO, the Managed Care Organization. I'm going to be giving you these acronyms, right? The MCO is the Managed Care Organization. In New Jersey, the Managed Care Organizations are United Healthcare, Aetna, WellPoint, why am I forgetting? Oh, Horizon, Bluecross, Blueshield, United Healthcare, Aetna, WellPoint, Horizon, Bluecross, Blueshield, and I'm a WellCare, right? Well, or now it's Fidelis. Yeah, it's now Fidelis. So these are the 5 managed care organizations that when you are electing to under Medicaid, under the Department of MLTSS, Managed Long-Term Support Services, to apply for Medicaid and begin home care services, you must choose one of these MCOs. So a lot of times, and most times, individuals who are eligible to receive these services under MLTSS are, over 65. And I say over 65 because they could be anywhere from 65 to 85 or 90. But the point I'm making is that they're already Medicare eligible. So because they're already Medicare eligible, most likely already have chosen a particular provider for their Medicare. So I'm going to say in my mother's case, her Medicare, I believe, is under Aetna, and her MLTC in New York, they call it MLTC. That her Managed Long-Term Care Organization, or MCO, is Empire, Bluecross, Blueshield. So I try to explain that to say it is a totally separate insurance. It's not. It has nothing to do with her Aetna. Her Aetna, covers her doctor's visits, her hospital stays, her prescription. She has, I guess, a monthly OTC card that covers like incidentals, and what the normal insurance under Medicare would cover for someone over 65. And so initially, when we started services for her, we paid out of pocket. And so I'm saying this because I explained this, and we were able to divide it up, amongst her children, right? And who else would help? No, because we had to renovate her house. There was a lot that went into creating a safe environment for my mother to receive home care services. And I know that's the case for other people as well, right? So in this instance, in the conversation I was having during this intake, I was letting her know that, she kept saying, I don't want her to change her insurance. I don't want her to change her insurance. We can't change her insurance. And I was like, what is she talking about? So, and I realized how, confusing this is, that, applying for MLTSS, Medicaid, for Managed Long-Term Support Services, it doesn't affect your Medicare. Like, your Medicare is whatever it was, covering whatever it is. And, during your annual enrollment period, you can switch to a different insurance provider or keep the one that you had. And that's separate. And it does what it does. It's there for your regular hospital visits, the hospital doctor visits. If you did need to go to the hospital, emergency room, things of that nature, your medication prescription plans, and under Medicare, and it is whatever it is that you elected, and it does what it does. So in order to pay for home care services, you can pay out of pocket. As I said, while we had applied for MLTC, for my mother were waiting for the assessment from the state Medicaid to come from the nurse to see how many hours she was going to be approved for, and then choosing an MCO, a managed care organization, choosing that organization so that they become her MLTC provider. And again, in New Jersey's MLTSS, Managed Long-Term Support Service Provider. And that insurance company, I think sometimes people think, oh, well, I'm on Aetna, so both should be Aetna. I'm on United Healthcare, so they both should be United. I don't want to say one really doesn't have anything to do with the other. So, because they're totally different parts of the agency or of the insurance company, and very, very separate, because they do two, and I don't just not two, but they do very separate things. And so, making sure that you have the proper insurance that covers for home care services is key. And like I said, you could pay out of pocket if you have a long-term care insurance plan that you had paid into, maybe from your job, or you had purchased one separately. And the MLTSS process in the state of New Jersey, going through the state Medicaid, a New Jersey Family Care, applying for Medicaid, and choosing who your provider for MLTSS is going to be. And so that in New Jersey, you have United Healthcare, you have WellPoint, you have Fidelis, you have Horizon, Bluecross, Blueshield, and I'm forgetting this one. How am I doing that? But Aetna, WellPoint, United, Fidelis, Horizon, Bluecross, Blueshield. I did it. But what I will do is I will put this list in my description so that people know, under MLTSS, these are, in the state of New Jersey, these are the 5 carriers that you have to choose from. And whatever the Medicare is the Medicare. And in the MLTSS, these insurances under MLTSS cover home care services. I hope this is helpful. Like I said, I'll try to write as much as possible. And I will also put my phone number in the description so that if you have any other questions, you can reach out. Have a great day and enjoy the Super Bowl.